All right, we are here in the operating room. I wanted to film this in the operating room because it's an important area where we do surgery, and I want people to remember that it's surgery. So the purpose of this video is going to be complications. I'd say in the last few months I've had the same complication over and over again with patients, and that is that people aren't resting after their surgery. So I'm here in the operating room because I want people to understand that when we do surgery, whether it's a BBL or liposuction, a breast augmentation or a tummy tuck, whatever it is we're doing, it's real surgery. Even though we're not entering the abdomen and we're not going to be around your vital organs, if you don't rest after the surgery, in all these operations, we are lifting the skin up, we're doing something with the skin, and that skin has to settle back down. And if you don't rest, then that skin, instead of settling back down, it's going to hover up there, it's not going to settle down, it's not going to come back up against the muscle or against the implant or against whatever it's supposed to do, and you're going to get what's called a seroma. That's what all these complications I've had are. We're going to talk about a few of them. I did a breast reduction and the patient was too active, and she wound up getting a seroma, which is a collection of fluid because the skin didn't settle down on her breast because she was too active for the first week or two, and I have to stick a needle in there and drain it. Another patient had a tummy tuck and she felt great, so she started doing her housework around day 7, right after I took out her drain, and that's a mistake because if I take out the drains, the skin still has to settle down, and it didn't have a chance to do that, and she came back a week later and I had to stick a needle in and take out several hundred cc's of fluid. That's because she didn't rest. And everybody comes in and they say the same thing. Oh doc, I overdid it. Like I'll tell them, you have a seroma, I think you overdid it, and they'll say, yeah, I overdid it. People aren't lying to me, but what they're doing is they're not resting. So when you watch this video, I want you to remember that if I say that you have to rest, and that the rest period after a tummy tuck is 2 weeks, it's 2 full weeks. It's not, well, I feel good after 1 week, so I'm gonna get up. If I tell you after a breast reduction, you have to rest for those 2 weeks, you have to rest, you have to wear your compression, you have to have everything pushing against everything so it all settles down in the right way. If you don't do that, you're gonna take your recovery time and you're gonna expand it 2 times longer, 3 times longer, 4 times longer. So instead of being up and around after a tummy tuck at 1 month, it's gonna take you 2 months. Instead of being up and around after 3 weeks after a breast reduction, it's gonna be 2 months. So you really are hurting yourself if you don't rest for the time period that I tell you. So please keep in mind that most of the complications that I see aren't from what I've done, it's from what people are doing after the surgery. So if I tell you to rest, please be sure to rest. Take that time off from work that I tell you you're gonna need, and trust me when I tell you you're going to need that time.